Hello, my name is Raelyn Little, and this is my patient, Kate Kellum. So Kate currently presents with flaccid dysarthria, and what flaccid dysarthria what it is caused by are impairments to the lower motor neurons that affect the cranial nerves and the spinal nerves. So, which overall may cause weakness in speech and respiratory musculature, which can affect your speech production. So what we're going to do today is we're going to implement 5 different treatment behavioral tasks that will help Kate's communication be overall more effective and more efficient by targeting different parts of her communication that are impaired due to flaccid dysarthria. So the first treatment we have is we are going to focus on treatments for Kate's resonant deficits. So Kate presents hypernasal speech, and this is why we're going to target resonance deficits. So due to Kate's hypernasal speech, we're going to target different treatment tasks that will help minimize her resonance by modifying her speech. So what that entails is, one way to modify speech is we can focus on reducing the rate of speech. So by reducing the rate of speech, it can increase speech intelligibility and lessen the perception of hypernasality in some individuals with flaccid dysarthria. So that's what we're going to try for Kate. Okay, so how to implement this? So Kate, we're going to focus on just slowing the manner of your speech, and this can allow for your speech intelligibility to increase because it's giving the time for the movements, like your tongue, all the articulators in the mouth, is giving those time to make these connections, which will help facilitate increased speech intelligibility. So one way to reduce the rate of speech is we're going to focus on what is called finger or hand tapping. So what this is going to look like is every time I tap my hand on the table, you're going to say a word. So for example, the sentence we're going to focus on is, "My name is Kate." So I'll tap my fingers. My name is Kate. I want you to say a word on each finger tap, okay?
Okay.
So let's try it.
My name is Kate.
Okay, perfect. So this is a strategy just to reduce the rate of speech, which may overall increase our speech intelligibility. Okay, so the next treatment task is we're going to focus on phonation. So in individuals with flaccid dysarthria, you may see damage to the muscles of the larynx, thus resulting in breathy or harsh vocal quality. So therefore, we are going to focus on different implementations, what is known as a pulling and a pushing procedure. So this is going to help in the vocal fold closure. It's going to help vocal folds come together by increasing the muscle contractions, which will overall improve speech intelligibility by contracting these muscles, which will produce a stronger voice. One way we're going to do this is, like I said, through a procedure called pushing and pulling. Okay, so basically what we're going to do is you are going to bear down on the arms of your chair as hard as you can, and as you're bearing down on the chair, I want you to prolong the vowel ah. So what this is going to do is it's going to contract those laryngeal muscles, so it's really going to work at helping with this laryngeal musculature weakness. Okay? So on the count, so you're just going to press down. As you press down, just say ah for as long as you can. Okay, go for it. Ah. Perfect. Do you kind of feel it tightening? Okay, so what this exercise is doing is it's just helping with those weakened muscles. Okay, perfect. Okay, so that was for phonation. Okay, so for the next treatment, we're going to focus on prosodic deficits. And so damage to muscles that help vary vocal pitch by stretching and relaxing the vocal folds, this can be so flaccid dysarthria can cause this damage. So therefore it can affect prosody, which is huge in speech. So one example, one exercise we're going to do to facilitate overall improvement of prosodic deficits, we're going to focus on what is known as contrastive stress drills. So these tasks are designed for me, the clinician, to ask a question with the patient, Kate, answering by adding stress on keywords to convey an intended meaning of an intended meaning of the answer. So, for example, okay, so this picture right here. All right, so I'm going to have you look at this picture. So, is the man playing basketball? And I'll explain this task, but is the man playing basketball?
Yes.
Okay, so what this is, I'm going to ask you the question, is the man playing basketball? I want you to answer by adding emphasis on the, by adding stress on the keywords, sorry, to convey the meaning. Okay, and he's, oh, this is the one I was showing you. He's playing football.
Okay.
Okay, so what we would say is, Kate, is the man playing basketball? And you would reply, no, the man is playing football.
Oh,
So
okay.
you would add stress on the keyword that really conveys the meaning. So he's obviously not playing basketball,
Okay.
so you would add stress on that. So we'll do it. So Kate, is the man playing basketball?
No, the man is playing football.
Yes. So that really gets your message across. Okay. And so we have those. So those can just be a drill of questions where you're just emphasizing your stress on that keyword. Okay. So let's see. The next one we have, or the next treatment we have for flaccid dysarthria, can typically involve treatment for articulation deficits. So we treat articulation deficits in individuals with flaccid dysarthria to improve their overall production of certain sounds, which will help their speech intelligibility increase, which will help individuals be better to be understood by strangers. Okay, so one of these articulation treatments is known as minimal contrast drills. So basically what I'm going to have my patient Kate focus on is we're going to concentrate on producing pairs that vary only by one phoneme. And so by doing this, we are going to work on these consonants, because working on consonants will enhance intelligibility in most patients. So that's why we're going to implement this strategy. So, okay, for example, minimal contrast drills. So can you read these two for me, these two words?
Park, bark.
Okay, you see how they just differ in one phoneme in that one beginning consonant? So we're really going to focus on this, because doing these drills will may enhance your overall speech intelligibility. Okay, we're going to start with these.
Dime, mime. Hat, bat. Light, night.
Perfect. Okay, and there are our minimal contrast drills. Okay, the last but certainly not least treatment for flaccid dysarthria may involve treatment for the respiratory weakness. So some, like I said, some symptoms of flaccid dysarthria may include inefficient breath support, which overall is respiratory weakness. So we do some respiratory weakness treatment, or we do treatment to maximize respiration function, which is crucial for adequate speech production because we speak on exhalation. So we need that respiratory function to really produce adequate speech. So, okay, one strategy that we can do to improve our respiration is just called a correct posture. And this is just a strategy that I can just remind Kate throughout the session to sit in a correct posture. Because sometimes poor posture may result in shallow breathing, which often affects phonation and prosody, which can overall deeply negatively impact speech production. So we're going to implement a strategy with correct posture, which is basically just asking the patient to sit more upright. And by doing this, it can facilitate more like enhance and increase respiration for speech when speaking, when your head is up and your shoulders are back. So, okay, Kate, you'll just sit up for me, shoulders back, heads up. You'll just remember to sit like this as we speak. This will really help them facilitate better production, better respiratory production to help you get more words out clear and better. Okay.
Thank you.
So, awesome, yeah. And those are our different treatments for flaccid dysarthria.